As a part of our faculty development program, today we will be having a medical coding course or medical coding session. After which we will be signing an MOU, memorandum of understanding with Thoughtworks Medical Coding Academy.
Hi. Very good afternoon. So, hope something know about me that before I came on I was month, right? No? Okay. So, you have any idea about medical? Okay. So, with this section, you will have an idea. So, before that, let me introduce myself. My name is Leena. I'm the branch manager of Whiteside Outpost branch. So, here we are there to give you the in detail info about medical coding. Invite my gurus and my founders of Thoughtworks Medical Coding Academy. Mr. Balamurali Sine is the managing director and founder, and Ms. Bhanumati Chaudhary, she is CEO and founder. So now, there is a few questions. So here we have India, which was started with one mission of Devot in one city, and now we have 12 branches in India. So where multiple cities coming to 4 states, and we have tried 1,000 plus students in this span of 9 years, and that's all because of one idea and one mission. The reason for the success and everything was the backbone completely, the both people. So now they will explain you, they take the responsibility to make you to understand about all the medical coding. Can we start? Very small response. So, before starting the session, we are not here to change your career. First of all, I really appreciate that each one of you have chosen the pharmacy field to take your career. Without pharmacists, no healthcare will work effectively, isn't it? Can we give a great round of applause for all the pharmacists in the world? We are here to introduce one specific career path. We have multiple career paths for pharmacists, like pharmacovigilance or research, many things are there. Those, one of the field is medical coding. That will use your creative ideas, make you to work in healthcare MNCs. So that is the reason why we are here today. So before going to the session, I just want all of you to tell me one thing. We will hear you today. Yes? No. With that, it does not understand. Yes or no? Understand, because you are also in college when guest lecturers will come and they will be saying some stories. Backside we will sleep. Some lecturers will come. They will work up for us. Yeah, it all will happen. You guys are intelligent in your classes? No. They are answering. You guys are answering. Or the right first benches will be the first in the class, first rankers. In your out of you. Very good, very good. So I know we have multiple streams here, like pharmacy and MLT. How many of you from MLT? PMLT? No, only pharmacy. Only pharmacy. Yeah, very good, very good.
Have that the basic dynamics. So before that, we have a couple of questions. We want to know like what the answers we get. So how many want to work as a pharmacist in OP or IP? What it really? How many want to work as a pharmacist?
Only two.
1, 2, 3. Okay. Second question: how many want to work in a formulation in the companies? Industry side. How many want to work in industry side? They can raise like whatever you feel. Don't see like your friends. If they raise, you also will raise hand, right? It's not like it's all about your career decision. So no one want to go for industry side. No. How many want to go for research? Okay.
Only one. Two.
So how many want to go for pharmacovigilance? Not aware about that. Okay. Clinical research, pharmacovigilance. Right? There are lot fields integrated to pharmacy. Today we came here to teach you more about medical coding. Okay. So first of all, I did my pharmacy from Tirupati. I'm also a pharmacy graduate. And after pharmacy, I wasted like 6 to 1 year of time to shifting from one to next to like that because no one is there at the time to educate me which field suits for us, right? So this is one of the great platform for you. First of all, I want to thank the college management for having this wonderful session. So you play this next to 1 hour because in the next 1 hour we are making you to the entire deep knowledge into this medical coding. Okay, maybe we don't know, right? Maybe 10 or 20% can choose this field. Okay, and maybe it can change your career, right? So now I can say probably that after I work in medical coding, we have our own coding company where like 100 plus employees are working, and in my company the highest salary where we are paying is 1.5 lakh. 1.5 we are paying, not in a position to take the salaries from, right? So I think that you have to work in whatever domain it may be for some years, gain the experience. Again, you have to come back for the same college as a guest lecturer. Yes, again, okay. So just focus on the next 1 hour. So don't sleep. Maybe I already said that. Send me one of if one got impact also. Our time got we will happy for our time what we are spending here. So we'll start the session. So in between we'll have questions, we'll ask academic questions, and even because I'm from pharmacy, right? I have all the pharmacology drugs also. We're ready for that. So who are saying answers? We have surprise gifts also. So we have run the competition at the end of the session in Instagram. We just participate in that, and we get different coupons in there. Okay. So from the session only we'll ask the questions. We are not asking the question out of the syllabus. So on your medical coding. No one? Okay, then we'll start.
No one knows about medical code. I think you heard about that. Right. How you know about medical code? How you know?
Oh, super. Good, good.
Very good, very good.
That's a great. Before you complete your graduation, you get into some skill development.
Yeah. So we know that we have chosen a career, we have chosen a degree to go into specific career path. But medical coding in healthcare is a hidden hero that many people don't know. Out of all the pharmacy students or nursing students or life science graduates, all are not getting jobs in their dream career. Out of that, we have a specific multinational company, healthcare job, IT jobs, which is nothing but medical coding. So we all might have know about a medical record. We used to go to hospitals, right? We go to hospital, we will get some treatments done. They will be giving us a prescription. Here it is a prescription, but a medical record consists of the patient, disease, the treatment or procedure done, and the supplies like ambulance or any cotton that they have used for the patient. So all these three things we are going to convert into alphanumerical or numerical codes. Software coding is different. Healthcare coding is nothing but conversion of patient disease, treatment and supplies into alphanumerical or numerical codes.
Okay, so we'll have some questions. I say some disease condition or any surgery. Just let me know whether it's a disease or surgery. Okay. The patient is coming for gastritis. It is a disease or surgery? Gastritis. It's a disease, right? Doctor performs gastrectomy. What is gastrectomy? What is gastrectomy? Gastro.
Gastro means
We have gastric columns, right? Gastric nothing but stomach, right? And what is the medical term for removal? Ectomy. Okay. What if a doctor remove your stomach? Maybe you are eating too much of food. You went to hospital. Doctor said, okay, we'll remove the stomach. Yes, we can do right. For obese people are done. So what is removal of stomach called as? Removal of stomach.
gastrectomy.
So medical, because you require medical terms if you want to work in medical coding. Okay. So medical term for stomach is gastro, and removal medical term is. We just club both the things. What is removal of stomach? Gastric. For example, you're talking too much. Okay, doctor, remove your tongue. What is that name? Removal of tongue. Tonguectomy. So the medical term for tongue is glossto or lingo. We can call it a multilinguistic, right? Some people. So we'll call it a glossectomy. What is glossectomy? So if you are going for interview, they'll ask this question. So, clear? The medical terms how they will quote and all. Now you see that all the books we are using.
So we have three books for medical coding. One is ICD, second one is CPT and HCPCS. In the patient medical record, what exactly the problem of the patient we can call as a disease, right? Disease or diagnosis. That we can choose from ICD book, which is International Classification of Diseases, which will be published by WHO. More than 74,000 diseases have been published till this year, 2026. Each year this book will be revised because new codes will be appearing, example coded. After that, the books will be revised for entering the new codes. So ICD we will be using to code the diseases of the patient. CPT is nothing but correct procedural terminology, which will have the procedures or treatments. Now he said gastritis. Gastritis is a disease. Which book will use for that? ICD, classification of diseases. Gastrectomy is a procedure or treatment, right? From which book we need to take that? CPT, correct procedural terminology. By providing the gastrectomy treatment, from the hospital they will use some drugs, some cotton, and some trays, some scissors and all. These are all supplies for the treatment from the hospital, right? So these supplies will be coded from HCPCS book, which is Healthcare Common Procedural Coding System. So there are three main manuals for medical coding, which are ICD, CPT, and HCPCS. So WHO, how many of you know about that? World Health Organization. What is the work of WHO? Identifying the diseases, right? And taking the statistic of diseases. After that, they will publish all the diseases along with the codes in the ICD book and CPT and HCPCs.
Because you well familiar with WHO during COVID time, right? In the COVID time, they have a live data. Which city, how many people cases are there, how many users, all the data was provided by WHO. Okay. The same organization will publish the book IC. Okay. And you have a doubt whether we need to remember all the codes. It's not like remembering the codes. So once you're entering the coding companies, they have different software tools. Even we build our own software tool also. We'll show you in the upcoming slides. Can go for next. So instead of using the books, the same book version, we have a tools. So then you should know how to navigate the tool. If you know how to navigate the tool, using the tools, you can code any disease condition. So just like that combination, because we get lot of errors in combination code. When a patient is coming for diabetes, along with diabetes, any other conditions are there, we should not use separate codes. We have to do combination. That and all we can easily code with help of software. So no need to remember any codes, just we'll use the software.
So this is a medical coder work. So once they will be receiving the medical records from the doctors or the physicians, they need to process the charts. That means the medical coder needs to review the patient medical record very keenly, and then they need to identify for what reason the patient comes in the hospital, what is the treatment they have received. Either they have taken any surgery or they have taken any injection or only tablets like that. We need to review the medical record and we need to convert that complete medical record into ICD, CPT and HCPCS code format, which is very easy to the other people to understand because these are all universally accepted codes. For each code, the specific dollar value will be there that no one can change. So this is how a medical coder need to work in their daily basis. Yeah, this is revenue cycle management. Before going to know about what a medical coder do, we need to understand the healthcare of India and other countries. In India, the healthcare will be very easy. As we know, if you got any fever, for example, you got severe fever and you get leave for 2 days to college, they didn't have to that I know. You went to hospital, what did you do? You will go to hospital, you will meet the nurse, you will tell what is your problem, then you will meet the doctor, you will take the prescription, you will pay the bill there itself or you will come home like that. They won't leave you, right? If you are not paying the bill, they won't leave you. Either it is 100 or 1000 rupees, we need to pay the bill in the hospital itself and then we need to come back. But in other countries, it is pretty much different. In India, very less people have health insurance. But in other countries, it is mandatory. Each and every citizen has health insurance. We are that only they can take the treatment. For example, I got headache. I have to take private appointment from one hospital. I need to go there. I need to submit my health insurance details. Instead of I need to pay the bill, I will give my insurance details there. Because in insurance, we will be having separate types like government insurance, private insurance, how much surgeries will be covered in each insurance like that. Once I have submitted my insurance, the doctor will see me, he will give the treatment, and I will come like that. I won't pay any bill. So that is that medical coders play a key role from by getting the payment to the doctors. So we will see how the medical coders are key players to get the payments to the physicians.
You can go for medical term. Okay, I already said right. So end of the day, we have one competition. So we'll see who will win. From this only we'll ask a question. If possible, you can make a note of the main abbreviations and all. So what is the full form for NCPS? Okay, not no. That's the reason. Just make a note which you don't know at all. So then that will help you for your assessment. So first we go to the medical terms, which already you covered in your graduation, and then first and second year. So when you are going for any interviews, the first round of interview will have medical terms. Even the written examination, some coding companies will have like 50 marks exam. So all the 50 marks will have these medical terms. So what are parts of medical term we can see? Like we have three parts, right? Prefix, suffix, and
Root
words. Okay, so these are all the things they'll ask. So come to the root words. So the main word is called root word, right? So now we have some questions. I'll locate any one of you. Just see everyone to my side. I'll ask question. From the last row. What's your name? Last first. Last. Yeah. What's your name? Okay. So what is the medical term for liver? Not under. Hepatic. Okay, good. Okay, next.
Clap, clap.
Thank you. Next. What is the medical term for salivary glands? Salivary glands in medical. Different glands. Medical term for salivary glands.
Either it is wrong or right. We
Okay,
give
let
it
it
an answer actually.
What it may be. Salivary. Okay, what is the medical term for heart? Okay, simple, happy, cardiology. Good. So we had all the medical terms. You can see here. So stomach, gastro is the medical term. You can see your hand. Next, abdomen. What is the medical term for abdomen? This is one of the most common surgeries to see. If I say that thing, you'll remember. Okay, I see so many ants in the hospital. You see.
Big hoardings you will see in front of hospital.
You heard about laparoscopy? The medical term for abdomen is lap. This sentence you not have it, right? The medical term for abdomen, lap. If doctor places the scope inside the abdomen, what is the name of the procedure? So the scope is to visualize the internal organs. As they place the scope in abdomen, we call as laparoscopy. If doctor places the scope in stomach, gastroscopy. They place the large intestine. Large intestine medical term is colonal, right? We'll call colonoscopy. So just the main terms is important. And if you remember, you can crack it. In 60. Right? Next, what's the medical term for digestion? Digestion. Okay, after having heavy biryani on Sunday, we'll have some drinks, right? Like Coke, Pepsi, and Sprite. Even if the medical term came, even the company name came from this. You heard about the name Pepsi, right? So the medical term for digestion is Pepsi. So next time you remember, okay? Digestion medical term is Pepsi. Okay, so what is called dyspepsia? Dyspepsia.
Digestion, right? Dyspepsia means difficulty in digestion.
Like dysfunction will call as malfunction, the same thing. Okay. So because if you're muck upping the medical terms at the time of interview, you can't crack this because we forgot in the time of pressure, right? You should go with any logics behind it. So you remember, right? What's the medical term for digestion? You remember Pepsi. Stomach. Abdomen. If any student is speaking multiple languages, we'll call as multilinguistic, right? So lingo also term. Multilinguistic is a term. So that means you should remember all the root words. Okay. The root word is the main anatomical word. Next.
So these are prefixes. We have discussed about the root words or keywords, right? Most of the time, the keywords or root words are body organs only. And the functions, these functions and faster functions, this will comes around the prefixes and suffixes. So these are the prefixes we can see. What is prefix means slow?
For example, your heart is beating very slow. This is what this is, right?
You know, right?
No.
Very nice. Slow means slow means bradycardia means slow function of the heart. Here, slow means only brad. And fast means brad. Very good. Outer layers. You might have studied in your biology also, zoology also. Outer layers.
What's
Ecto or endo?
Epi.
Ecto, epi. What is the outermost layer of the heart? Sorry? Which part? Epicardium. Epi. Inner means? Endo. Very good. Very good.
Okay, now what is the disease condition called as slow dilution? If you have a very slow dilution. I said all the terms, right? You just form it a term. Slow medical term is? What's the medical term for slow? Okay. What is dilution? This club both. Bradypepsia is a condition where the patient has slow dilution. Next. This is the most important because when you work for a surgery coding under, they'll ask the surgeries. Okay, various surgeries. So like incision. If the doctor make a small incision any part, example, they make incision abdomen. What is surgery name for incision abdomen?
Abdomen means? Very good.
So incision is called as otomy. Otomy is the incision. You can see O-T-O-M-Y, otomy. If doctor makes incision chest cavity, doctor make incision, we'll call thoracotomy because thoracic area, right? So thoracotomy is the incision of chest. What is repair? Repair is stitching. Very good. Correct only. Medical term. Medical term for repair. So for example, you have any cracks in the wall, what will do? We'll do some plastering, right? Okay, same thing here. So repair medical term is, for example, doctor repair your nose. Doctor needs some repair in your nose or stitches. What's the medical term for nose? Nose medical term is rhino, right? There is one animal called rhinoceros. You heard about? Why? Because they have big nose, right? That's why they gave the name rhinoceros. Okay. So rhino is the medical term for nose, and repair of nose is called rhinoplasty. Next. Canary. This is the most common disease condition in all the tract systems. Because you heard about asthma condition, right? For asthma, we have different drugs, right? What are drugs we use for asthma? Okay. What are bronchodilators? Which will dilate the bronchus, right? So what is the medical term for narrowing means? Which is stenosis. Opposite is called ectasis. Enlargement is called ectasis and narrowing is called as stenosis. So we have to check like which term that the patient is suffering from that. Okay. Next, what is the medical term for enlargement of heart? If heart became very big. Because cardiomegaly. If thyroid gland became very big means thyromegaly. Okay, so you should know all the.
So most of the people having alcohol, right? So what the organ it bulges is super connectivity. What is the enlargement of liver we can call as? Megaly means enlargement based on the organ which is going to enlarge. We need to keep the so as he said we need to remember the medical terms like root word, prefix or suffix. Simply if you are magnified up means you won't get any errors. Okay? Got it everything?
See one thing because I am from pharmacy background, right? Once I get into coding, I am able to begin a QA within 3 months because that's the advantage we have. We gone through all anatomy, know all the drugs. So easily you can able to learn how to code a chart faster. If you code very faster, you can go for next question faster when compared to other graduates. Use that as advantage. So you just brush up your anatomy skills. This is the first step to crack your interviews. Okay. So what are you focus on? Root words, prefix, suffix. This is the first thing to enter into the coding. Okay, next, all systems you have to go through, like your body systems. My tuition days, because whenever we went for evening tuitions, right, 6 to 8 o'clock, always we prepare for when the current will off. We get relaxation, right? But my maths teacher that time will ask the questions, tables will ask, okay, you are, he will not, because that time everyone will, they won't be visible problem, right? He will call up the name and he will ask the question. That time it's a very power will come. Because he doesn't stop answering to those questions. Okay, we are all in the same page. You can continue. Okay, good.
So, body systems will be there in human body. Body systems. 12. 12 systems, right? So, first row, you get one body system. Give that card. Anything, any body system. Urinary system. Nervous system, system, middle row. Sorry, reproductive system. This side. Reproductive system. Very good. Very good. That side. Which one? Digestive system. Endocrine system. Very good. This side. Okay, the musculoskeletal system. Back side. Which system? So, integrated system, very good. We have respiratory system too. What is next system here?
We'll have some questions, you can get some chocolates and you should be able to answer.
Look at the respiratory system in this. We are causing but it is fine. Here, so all together we have 12 organ systems in the human body. Okay. So each and every organ system has its specific organ and functions to do. So for all of the organ systems has been completed. Body system, how it will work, right? If I talk about cardiovascular system, what the organs we have? Blood vessels. What are the blood vessels? Veins. Both together we can call as a small vein and outer we can call as and venules we can call as capillaries. Very good. So how many layers will be there in the heart? 6 layers. Which is the important layer? Myocardium. If blood supply stops to myocardium, what is the condition we can call as? Myocardial infarction. That means complete stopping of the blood supply, which will lead to the heart attack. Right? So this is how the organ systems we can connect with our graduation.
Okay, we have 3 questions now. So who said exact answer? We have copy. That is copy chocolate. So I'll say some disease or surgery. Just you have to say which system it belongs to. So easy. Okay, we'll start. I'll say one disease or any surgery. You just say which system it belongs to. Okay. So question number 1, who will answer? You want question, right?
Choice is yours.
Because the confidence makes sense. Who want to answer? Okay, what's your name? Okay, you are good. For your confidence, because that's important. When you work for corporates, who raise the hand first is important. They'll get notified. Rest all the people in the same position. But I want to appreciate you. Question number 1. So the disease condition is a triple B disease. Triple B. Bundle branch block. Belongs to which system? Bundle branch block. It's one of the disease conditions. Nervous system. Okay, good at any other?
Bundle branch block.
It is a contagion system. So we have XA node, AB node, right? Remember? Later. We thought I'll ask simple question, right? Good, good at it. Thank you. But I get the chocolate. Okay. Okay, next question. Okay, super good. What's your name? Manoj. I'll ask simple question and tough question. So what page is coming for acromegaly? Acromegaly. Which system it belongs? Acromegaly. Okay, super, very good. Okay. Extremities, right? If you have big fingers, we call as acromegaly. Enlargement of hands and extremities. Okay, last question we go into the section. I want one from girls' side because every section needs to go answers from the girls' side, but here we are getting from boys. That's good.
It's a prestigious teaching model. Anyone cannot write the hand. Very good.
So last question, like the patient is coming for pneumothorax. Pneumothorax.
Very good.
Because you can see there is pneumo in the lung, right? That. Okay, then we jump into the coding part. Now we'll teach you how to use the coding book, the most important part. See, watch this video and say what is the name of the surgery. Okay. Once the video was done, you can raise your hand and say the name of the surgery. The video is just getting started. You watch the complete video and say the name of the surgery. It's not yet completed because surgery now only started. Wait till the surgery got completed.
In between, don't come out of operation theater. Please complete and come.
Yeah, read the. You had watched the complete video and say the name of the surgery. That's. There is one surgery and multiple surgery. You have to name it. Okay, last. What's your name?
Yeah.
Okay, Aditya, surgery was done. Patient successful and he is alive only. Now, what's the name of surgery? Okay, super, very good. So, it is called ETP placement. Endotracheal intubation. One more surgery procedure also is there. There is a one more procedure was there in this video. So, the ETP will attach with the ventilators, right? We call mechanical ventilators. During pandemic, we heard, right? Most of the hospitals don't have this ventilators at all. You do manually. So this is a ventilator. So for this, we had about two CPD codes. So one is intubation code and second code is a mechanical ventilator. Okay, good. Thank you.
Thank you. Yes, sorry. Thank
Okay.
you. Okay.
After session, we'll give tea also. Okay. So just we'll take outline of the books, just focus on that. After the college MOU, we will take you like 1 week of free sessions for you. You can join those sessions and you can listen, understand. If really suits for you, you can continue that. Okay. So just pause the next upcoming slides.
So first we'll go through the CPT book.
So what is the full form for CPD? Correct procedure. Terminology. Okay. In this book, we can get all the surgery codes, and this book was updated every year. So you can see the updations. Updation was done by AMA, so which is called American Medical Association. So these are group of doctors. Doctors will decide which code has to be added in the book or to delete the codes. Sometimes some old outdated surgeries will be there. They will remove from that book. Any new technologies are there. All the new technology codes will be added here. So which date it will be updated means every year January 1st this book will get updated. Okay. So who will publish this book? AMA. Okay. And which date every year it got updated? January 1st. Okay. And this book will have 6 chapters. The first chapter is called as evaluation management. Whenever you go to any hospital, doctor will evaluate you why you came to hospital. Then he will give treatment. For those doctors, we'll call as ENM doctors, which is called evaluation and management. For that, we have separate course called as 99 series. I'll show the course how to do it. The next chapter is called anesthesia. So everyone aware about anesthesia? If you want to do any surgery, first we have to do the to make the patient as unconscious. And next is a surgery department. In surgery, we have 6 chapters are there based upon the system like intubating, muscular, respiratory, digestive, human nervous system. So you are checking which surgery your doctor performed the procedure and you have to capture the group. And next is the radiology department. In this department, we can get all the scans, X-ray, CT, MRI scans. So each and every scan we can get from the 7 series. Next chapter is pathology. All the labs, what are the labs you're taking from the hospitals? For each lab test, we have codes in the 8 series. The last chapter is the medicine chapter. Then we have different injections, infusions, chemotherapy drugs get from the Insta competition. How many chapters are there in CBT?
So for the course is 0 series. Now integrated 6 chapters divided 1 to 6 series, and then radiology, pathology, and medicine 7, 8, 9 series.
So you can see the code structure. This is how they design the book. Okay. In this book, every code we have 5 characters. Okay, all numbers with some characters will be alphanumeric. You can see the code like 11200 because 1 series for the 6 surgeries. So it is the table of stats. So based upon number of intact patients coming, so we have that in the code. If a patient is coming for multiple skin tags, we have separate CPT code for that. So CPT code is 5 characters. You can go for next. So these are chapters. We don't want to touch big chapters. So this is ENM. Whenever you go for any doctor will evaluate you, they take the history, exam, treatment. For example, how this is tell you one life scan. So you go to hospital with severe headache. Doctor asks question that why you got headache. You say I had one session today in college. That's the reason. The doctor will say that what is symptom? You say I got that exactly they say they not worry, so we don't have anything. It's normal headache, and even happen. How they do that eat and we call it EM management. So I check the type of patient, like new patient, established patient, based on management, we are the codes. So we go to the department, we can go down this side. So once you're working in a code companies, the department is a very, very important role. You are exactly one department. Okay. In this, which is the highest, that is the toughest, that is the chart department. OP, IP, ED, critical care, nursing homes. You feel which department is not up to code?
Sorry?
Okay, critical care.
How many of you will see the departments when you go to the hospital? At least we will notice the departments. Anyone in the department next? Service department next? OP then? In which department patient stays more than? In which outpatient? Outpatient is sacred discharge. He will go, he will take the treatment, he will come out. Inpatient is admission. Now tell me which department pays more? Inpatient, because the patient will stay more days in the hospital and maybe treatments will be taken care and the progression goes. That means one disease to another disease, the diseases will be progressed. We need to give as many as codes as possible for the medical record. So inpatient pays more to the medical coders.
Because dogs will be more. Number of days you're staying is more, and number of doctors, medications, everything will be complex. So your target will be just 10 charts per day. Morning you will log in at some 9 o'clock. You have to have 8 hours. In the 8 hours, you have to finish the 15 coded charts. Once done, your target was finished. If you are able to code very faster, if you are putting extra charts, the extra chart will consider the incentives. Okay. The faster way to get incentives in one department is like IT. But you should know how to code, right? If you are reading a chart, again you are reading second time, then only you are taking the course, means will take too much of time, right? Within less time, you have to read and take the course. For pharmacists, mix of more pharmaceutical drugs, by using the drugs also will take the course. That's one of the biggest assets for us. You are entering into IP. Okay. When you choose a department, you go for first to prioritize the IP department. Next. This some of the codes you can see this anesthesia. You can see some of the codes of anesthesia here.
Types of anesthesia.
Okay, these are the codes you can see there. 00300, 320, 322. Based on which part I given anesthetize, so we have a code for it. And these are the surgery codes. Okay, watch this video and say the name of the surgery. You can create a video. Just watch the video and say the name of the surgery. Then colonoscopy is there. Okay. By using colonoscopy, what treatment they are doing reaction. So using colonoscopy, we can see the entire large intestine and some portion of small intestine.
Answer properly what they are doing with the colonoscope.
The scope will have the video cam. We have a lens to take the photos, lighting, water check, and we have instrumentation to remove any default part. You can see this how the instrument will be there. They have some concern here. It will wash out that area. The target has side to be removed. What the name of the question? Actually, that is a polyp. Okay, inside large intestine the polyp is there. The doctor removed the polyp, which is called polypectomy. Polypectomy by using the colonoscope. So because I know that how the mindset when you are a student, because I came from the same stage, right? When someone is saying something, we thought, okay, it's not useful for us. But after you come out from the college, no one will be there to guide you because your professor, lecturers, they can guide up to one extent only. After that, you will waste 1 year, 2 years, then you will think about job, right? So that time you realize that what is the importance of sessions conducted by the college management, because that's so crucial. Just 1 hour, right? You focus whether you're interested or not in the secondary class. Okay, be attentive, don't talk to each other. We continue.
Shall we go? If you are interested, we will go on. No?
So if you are interested, we can give more our experience. We'll say how this department works, whether it benefits for you or not. If you are not interested, we'll just go with the slides. We'll stop the session as soon as possible.
Please show your
Yes.
answer. Thank you. And just now we have seen the book which we will use for treatments. And now the most crucial book is ICD because it is having 74,000 plus codes in that. It moreover looks like a dictionary, but we need to understand the guidelines. For example, this is combo code, right? Patient is coming with hypertension, that means blood pressure. Along with that, he is also having the heart disease. Then we need to identify the combo code instead of giving 2 different codes. So the ICD is also divided into 22 chapters. 22 chapters. The first chapter is infectious diseases. That means whatever the pathogenic diseases we will be getting to the body, that will be there in the first chapter. Like based on the body systems and external causes for the diseases, all these chapters will be divided into. Keep ones. So, for example, if I got a laceration means cut on my skin. Which chapter will choose to code my disease. Cut on my hand.
There is a screen, right? You just check the screen system. If it's screen short, you are able to see from large. So you can see. There is a series, right? L series screen and for example, a pregnant patient is coming for some complication. Which code will go? Pregnant woman came with a complication. The code will start with post series. Newborn baby come with complication. Newborn baby. Next year, P is for prenatal code, right? That code we have captured. For example, patient is coming with a fracture. Injuries. Fracture injuries can come, scroll down. You can see the SFP code, right? Injury, poisoning, drugs, and all. This chapter is designed based on the system. We have checked which system it belongs in the course number. We will show you like a software tool also how to do that. We'll go for next slide.
So this is how the book will be divided into alphabetic index and tabular research. So the code with the description with the code will be present in alphabetic index, and finalized complete description code with all the guidelines will be present in the tabular list. For example, if a patient is coming with asthma, he is also having a wheezing. Is it possible to code both conditions? No, because wheezing is the integral symptom of asthma. When you see the alphabetic index, you won't see this guideline, but when you see the tabular list, you can see the complete description with guidelines. Okay, this is how the book will be divided.
You can go for the series block. Next series where to pharmacy, because in coding there are two types of like professional coding and facility coding. So what is profi coding means? Coding for physicians is called as profi coding, and facility coding is coding for hospitals. Hospitals are getting revenue based upon the infra what they're providing, beds, stretchers, drugs, everything comes to hospital payment. Right? So coding for the hospitals, everything will get from this book called as CPS code. Okay. For pharmacy, people it's very easy to code this. You can get all the drugs formulations. So you can see the classification of the codes. Here we have alphanumerical codes. So you can see here like dental codes, durable equipments, DME supplies, all the services you can see this. So even we have codes for ambulance also. How many kilometers the ambulance travel? What type of ambulance is provided? We can have the codes in the HCKs. You can see syringes, syringe with needle, 1 cc, 2 cc, 5 cc, every syringe also here. Hospitals, you want to make everything into codes. So in simple language, if any interview is asking the question, what is medical coding is? So medical coding is a process of converting the complete data, documentation into codes by using how many books? 3 books. What are 3 books? I3, CBD, and NCBS. This is one of the examples. So there is a one code and CBD, one code and NCBS. So this by saying that insurance company will pay the money for the physicians. Now we show the software. So you can see the software because we provided tools for you guys. After the session, we make one group for interested people. But those people we can make you an online session you can join. Along with some of the PDFs and tools we share, just in your free time you can browse it. Our intention is once you complete your graduation, the last day of graduation should be your first day of your corporate. Right? You should not waste your time in between that. If you enter into corporate very immediately means we have a high growth. We can able to achieve good growth in a less time. Instead of wasting your time is our main intention. So we used to call all the corporate companies because already we have our own company. If anyone needs extraordinary in terms of training, we will hire your own company. Rest of the people will outsource to other MNC companies. Okay. So you can see this one of the software tool. The same like line. Once you work in a coding company, the same tools will be there. Slight changes in the software tools. So one side we have documentation will be there. One side tool will be there. We have key and we have to capture all the tools. That will see once we are in now. Okay, you can see the chart here. What is CC? So the next 5 minutes is most important. I want everyone to attend from the slide. From the slide only I'll ask the questions. Okay. So what is CC? Chief complaint.
Chief complaint.
So chief complaint is receiver, frequency lower, abnormal complaint is 2 days. So HPA, HPI. History of present illness. What is the history for today's illness is called as HPA. Okay, abbreviations are not remember. So if a topic now the interview, then law honors. Okay, so don't give a chance to law on you others. Okay, next we can see that all the examination was done, physical examination, then finally we are assessment. What is acute? Complicated. What is UPA? What is the reason for admission? Why the patient came to hospital? Like they have some abdominal pain, dysuria. And investigation, what doctor is saying? You are suffering from UPA. Any treatment they given? Just go ahead treatment. Any drugs? What drugs they provided? You are pharmacy, right? You can see the drug in there. They test you by next. They are all answers are there. So now in this they are more in this condition, right? So what is this we got dysuria, UPA. You have to capture dysuria or UPA. If any patient having UPA, they will have dysuria symptom. They are just a symptom or condition. Any individual symptoms we should not capture. We have to put only condition. So you can see that from here, right? Primary diagnosis, secondary diagnosis. A patient can have a number of disease conditions. Sometimes if you see the age of 80 years patient, they have like 10 to 15 chronic conditions. All chronic conditions we have to capture why they came to the hospital. So once you are typing there, you can zoom in that. You can see the urinary tract infection sign not specific. The code is N39.0. But in this code, insurance company will understand that the patient coming with urinary tract infection. So don't read the complete document just by the code. The code has dollar value. Based on dollar value, the physician will get the payment. If you are not coding properly, your doctor won't get the payment. Your doctor payment is decided by the coders. Even there are so many frauds will happen in US. There are some people that have different certification. If you want to work under doctors and all, you can have some CCSP exams and all. If you do that, you can able to add some of the codes also. The doctor will get more payment, right? Like there some coders and doctors will do some fraud activities. But there are different complaints laws are there. If intentionally we are doing something to get the more payment from the physician, so there are severe penalties. Even they close the hospitals. Certain regulations will be there in the US. Okay. So while reporting, be careful and just follow the proper diagnosis. You know, if you go for audit and all, audit department will check that if any errors are there, they will solve it. So you can see all the diagnosis. Next we have the CPD code, NCBS code. Then it will go for auditors. Just you can show the full screen. Just for your understanding, we given here a sample. Once you code any chart in our software, it will show the percentage, how much percent the chart is accuracy, whether 50%, 60%, 100%. But you want 100% coding. Even one code missed also, I already said, right? Depends upon your doctor name. Okay, like that here you can report where you missed the code, what you have to add. You can see the tools. So like this tool, you use in companies. Per day you have to code like 15 charts and 20 charts and 100 charts. Depends upon department. All is right? Which is a complex department? Inpatient. After the surgery. The surgery is a bit complex. Sometimes one surgery chart will be 3 pages. You have to read the complete chart. Sometimes stop the surgery. Then you should not quote the procedure. They change some other technique also. So when they change the technique, we have to put some other combination codes like modifiers we have to put. So this is how the software tool will be there. We'll go for next. So this department is already been seen, right? So in medical coding, there are departments like how you have departments in hospital. The similar way, your department like IP, we call as IP code as 2P code as surgery code. Next, you can go for the next. Okay. And something is important.
Yeah. So first, what question we used to get is as a pharmacy graduates or nursing graduates, where we are going to work, whether in hospital or somewhere else. So medical coders will work in hospital also and in multinational companies also. If you go to abroad like Dubai or any USA like that or Canada, Britain countries somewhere, so you will be working in hospitals around with the doctors. That means patients will be coming and the doctors will release the medical records to you and you need to code, you need to bill and then you need to resubmit the clients to the doctor. They will send to the insurance company. From there, they will be getting the reimbursement. If it is in India, we will be getting the medical records from other countries. That means the time will differ, right? Here, most of the projects for medical coding will be coming from USA. So that morning is 7 minutes, right? And our time is the same. Okay. So when he complete the work and he will submit the medical reports. That means he will leave the hospital in night. That is our morning. We will go to the office and we will open the records. We will code and we will submit the records. Okay. So due to the time and due to the cost effectiveness in India, we are getting more projects. Multinational companies in India like Dell, Cognizant, Wipro, Omega Healthcare, Access Healthcare, Coach like that. Many companies are taking the project and even some companies having their own physicians to get the clients inside their companies. So in each company, more than 10,000, 6,000, 30,000 employees will be working in India. So who will be processing the medical records?
Coming for the abroad opportunities. So if you anyone want to plan to go for abroad countries, in India minimum you should work 1 to 2 years. My suggestion is you have to gain at least 2 years of experience in multi-specialty. You should not work in only one department. If you work in multi-specialty, then you apply for UAE places, different countries, different exams are there. Once you clear, you can work in the abroad countries. You gain good salary and good experience, again come back to India and start a coding company and come back to your college for training purposes. Okay. So these are different locations.
Different locations where we have medical coding companies, and these are some companies we have developed with.
Okay, this we want to end of the session as time limited enough. Right? We can continue or we can question session. 4:30.
Students use it.
But they say no. Okay, we'll end up the session. Okay, we'll have questions for questions from your end. We'll answer further.
Do you have any questions to ask us? Medical coding related.
Okay, fine. In last later we one inspiration story for you. So are you interested to listen a story? Okay, good. Last one story we point out. So how our journey started, what are struggles we face, and I'd say that maybe it will help all of you.
Story, right?
Nothing questions. Okay, so we have a quiz. After that, we release one Instagram post in that we have 10 questions will be there. So you attend all the questions and mention your name and correct answers. From that, we will take a lucky dip and we have like movie tickets and CD coupons in that. And which that we have to get what we have to do. So that data we will get from our team. Okay, we'll wind up last. Okay, we'll wind up 5 minutes. Let's start. Okay, so just we want to share the journey how we started. So we started our first branch in Coimbatore. So myself and Banu, we both work in Chennai, Dell International Company. After that, we worked with multiple MNC companies. While we work in the company itself, we decided we want to do our own startup. We don't want to work under anyone. We want to provide more employment. That's only the intention. So within some years of time, we gain multi experience. Like all departments we used to work, and we gain all the knowledge. And immediately after that, we thought to start a coding project. Okay, but starting a coding project is not easy. We have to keep a lot of investment. We have good people and all. And we started a project with some of 10 friends. Okay, and they did code well. Ultimately, they are not giving a proper quality. Physicians, we had to pay the money, right? But doctor said that you code my charge, I give like this much of amount. When you are not coding properly, we had to pay the penalty to the hospital. That's a cost. Okay? So it was lost. Initially, project was flat because we don't have good quality people. Then we thought like, okay, we want to make the first quality people. That's how the academy we started. So we started academy in Coimbatore with one branch. So after that, we expanded into 12 branches. So that's how we journey start. So after completion of 3 years of journey, to run the business itself is very hard for us because we had to pay the rent, current bill, salaries, right? We had to pay salaries for 3-4 lakhs at time. So at the time of second year, so we went to like huge losses and all. It's not interested, right? Then we'll stop. That's it. So then okay, we wind up that because it will be some time, right? You know, we have to go for the college meet now. So okay, then all the best. I think a great success for you. Wherever the field you are choosing that. You should not be in a position to shout the accent. You should be in a position to stand on the stage and talk confidently. Be in that position. Don't be one among the backgrounders. Always will be background if you are talking like that. You have to take to come on the stage and talk. Be in that position. Okay. All the best. Thank you.